Hello, I am Dr. Allison Gibson, an associate professor at the St. Louis University School of Social Work. And today I'm going to be talking a little bit about older adults and disaster events. Really, the purpose of this is to orient folks to just disaster events, what to expect, what is kind of the traditional process with that. Before I jump into things, I do need to disclose that we are funded by the Health Resources and Services Administration, or HRSA, with our Geriatric Workforce Enhancement Program funding. So our disclosure statement is here. And so really we're trying to focus today on talking about what are some of the phases to expect with a disaster event, and then also speak a little bit to some of the structural barriers that older adults experience when they're trying to prepare, respond, and recover from disasters. So this may be something that folks have seen before, but this is generally just a chart kind of explaining the phases of disaster and kind of what's expected. There's essentially kind of three, four-ish stages to kind of describe a disaster event. That first stage is really the pre-disaster phase. So this is typically when folks have kind of a threat or a warning associated with a disaster. During the actual disaster event itself, this is when impact takes place. And so usually we see kind of folks' well-being dip a little bit. During the event itself, it can be really distressing. Many, stressors are kind of happening during that. Then we tend to have kind of this upward, heroic kind of honeymoon phase that kind of happens as we have kind of that immediate recovery that takes place. And so this is when you hear all the, heartwarming stories about, things folks did for one another and rescues. And so it can really feel like, a big upswing in terms of folks' mood, their excitement, not feeling so scared or concerned about the stressors. But immediately following that honeymoon period, we see oftentimes things really dip back down again for folks as part of kind of the disillusionment that takes place following a disaster. That's when kind of the reality really sets in for folks of, the significant event that's taken place, all the damage, lives lost, different things like that can really weigh on individuals. And so we really see folks' well-being really drop during that time. And so that last kind of, post-disaster recovery phase, as we get into the reconstruction, this is where it's going to take a lot of time. It's a much longer drawn out than the event itself. But slowly folks kind of start to return to that level of normal, what they were kind of before the pre-crisis, and sometimes even improve as a result of kind of the reconstruction process, just depending on what kind of supports are available to aid folks following an event. So a lot of grief that takes place during that response period, but important work that can be done by professionals to kind of help folks through all stages of a disaster event. So let's talk about before an event takes place, before a disaster. This is often referred to as a pre-disaster stage, and is an area where professionals can really focus on preparedness, helping older adults to prepare for disaster. So this can be everything with, identifying who might have unique needs or risk factors associated with later life needs. There can be education about preparedness. So what can folks do to kind of ultimately plan, make sure they have resources in place, a strategy in place so that they're ready to go in a disaster event. Oftentimes this is talking about what kind of supports they have or don't have and trying to make sure folks are getting linked in. Organizations need to be prepared. So depending on the setting a professional might be working in, if you're at a hospital or in long-term care, or maybe you serve folks out in the community, how prepared is your organization in order to kind of deal with this disaster and the forthcoming recovery work that's going to be needed? Sometimes folks will sign up for special needs registries with their local government if they have maybe some additional needs related to evacuation, those sorts of things. So it's important to be familiar if those kind of community resources exist. And then other types of community planning, if shelters need to be established, where are they going to go? What does that look like? And so just being familiar with what kind of would happen in your community is really important. as you can imagine, these are not things that can typically be done in a day or two of an event. These are things that need to be kind of ongoing, that really should be kind of talked about in different settings. Age-friendly plans should be talking about these kinds of things. Your organizational planning should be talking about these kinds of things because you never know when a disaster is going to hit. And by the time you're aware that a disaster event might happen, there's really not time to set a lot of this into motion. So, when did we really start thinking a lot about older adults in the context of disaster? A lot of folks really point to a shift in the status quo when Hurricane Katrina took place in 2005. Older adults, of course, have historically had the highest rate of disaster related deaths as a result of natural disasters and other kind of man made disaster events. They're disproportionately likely to die in a lot of these disasters. Many times it can be due to factors associated with aging. It's not age itself that makes an individual at risk for having kind of higher mortality risk in these types of settings. In Hurricane Katrina, about 70% of the fatalities were folks 55 and older. And so because this continues to be a trend in most disaster events, it really started sparking discussions that we really need to be thinking more intentionally about the needs of older persons in any type of natural disaster or other type of man-made event, and thinking about what can we do, how can we learn from these events, and really try to ensure that we're doing everything we can to prepare and try to reduce the risk of some of these fatalities. And so AARP published a really famous report in the disaster context. We can do better, lessons learned for protecting older persons in disaster. And that's something I would invite you to take a look at if you have some interest. Other kinds of pre-disaster risk factors that could put an older adult kind of at heightened risk for having either difficulty recovering from a disaster or, being at increased risk for fatality due to a disaster, are things like having some sensory or cognitive impairment, physical decline, poor literacy or social isolation can put someone at increased risk, and having difficulty getting, the education about preparing for an event or the information about where to go in a disaster event. Other kinds of things such as financial vulnerability are going to play a role. So if somebody doesn't have the resources to evacuate or to store up maybe needed resources like water or extra food, that's going to put them at increased risk during a disaster event. And then again, lower education, or if a population is more transient, they're going to be at increased risk just due to not having the same resources to be able to plan and prepare. We know from the research that vulnerability can absolutely be compounded. Understanding dynamics like power, privilege, oppression are going to play a role in understanding risk for disaster. And globally, we also see minority status really associated with increased risk for disaster and having poor outcomes in disaster recovery. And so there's a real need to really kind of think and account for that when we're thinking about disaster preparedness. Bob Bullard is a very famous researcher who has done a lot of work in environmental justice. He's written a great deal about the role of power, privilege, and oppression within minority populations in disaster events, both natural disasters and man-made disasters. And so I encourage you to check out his work. He was a really big influence into why I started looking more into this myself. So how might, folks' experience be different? I just encourage you to just think for a minute. What does that look like for somebody that's maybe experiencing significant poverty, that's trying to prepare or plan for a disaster? What about an individual that's lacking housing? An individual that's here as an immigrant or an asylee? You can imagine they may have, some distrust in using some formal services, some fears around impact of discrimination or family. So some things to think about. Indigenous populations. How well has maybe a tribe prepared for some of these kinds of events? And how does this look different maybe for somebody that's in a rural area versus more of an urban area? So just some things to kind of think about as you contextualize what might be some of the needs of your families when it comes time to thinking about and planning for a disaster. A good first step with working with folks, and this is something anyone can do. Obviously, I'm a social worker, and we do talk about this with folks a lot. But anybody could have these conversations about, do you have an emergency kit? Do you have an emergency plan? And just talking through, what might be important to make sure folks have. With older adults, I really strongly encourage that they have at least 2 weeks of their medication, and that's difficult to do. A lot of us are limited in our insurance coverage. We really can't get our next dosage, our next prescription of medications until we're 2 or 3 days till our due date for the month. So that can be really challenging for folks unless they're willing to pay out of pocket. But these kinds of things are things we have to think about. Do they have first aid kits? Do they have their, copies of their medical records or even their photo IDs handy and accessible? Do they have, products to clean their home? Let's say their home floods. How are they going to be able to maybe clean that up? Do they even have the means to clean that up afterwards? So thinking about some of those kinds of things. If they have pets, we also want to be mindful of, do they have, adequate pet food? Those sorts of things that could really impact. If an older adult is limited on food and they're sharing that also with their dog, they're going to be even more limited while they may have to wait out the recovery efforts. I've got a link here to PrepWise intervention, which is something the University of Iowa has put together. And it's an intervention that actually talks through with different populations, having them identify their social capital and generating ideas about how to expand their social capital, their social connections, so that they can be better prepared for disasters. And there is a variation of PrepWise that's specific to older adults that they're currently testing. Nursing home preparedness in the United States. So shifting from thinking about the community more to folks in long-term care. This is a really interesting issue that we continue to see. There's been a lot of data in the last decade or two that's really talked about that we are just struggling to really ensure that facilities are prepared for natural disasters. Every 2 years, the Office of Inspector General puts out a report, about kind of how prepared nursing homes are to respond to natural disasters. And we continue to see that most of them are really experiencing significant challenges with emergency preparedness activities, whether that be how they can ensure proper staffing during emergencies or transporting residents during evacuations. So if they need to, let's say, we just had an event with a hurricane hitting Tampa. And so right on the coast there, they had to move folks inland, more towards Miami, more towards Orlando. So moving them away from that side of the state that was about to get impacted. And so, how do we get all these folks transported? Do we know where we're taking them? Is there space at other facilities to accept these evacuees? Is there, the means to get folks there? And then once they're there, do we have adequate staffing? What does that look like? Now, in this case, that's a great example of where we kind of had a lot of notice in a community that's maybe impacted by a hurricane, and then they ended up having significant flooding, such as up in, let's talk about Asheville, Chimney Rock, some areas that were recently hit by Hurricane Helene that weren't anticipating having significant damage and then ended up having significant flooding. In those kinds of situations, how do you get staff there? If folks cannot physically leave their home, the roads have been destroyed, what does that look like? And so a real challenge in terms of ensuring that not only we have a plan, but then being able to execute that plan as well. And so it's estimated just in the most recent report, only 24% of nursing homes in areas of high risk for disasters receive deficiency for not meeting emergency preparedness requirements established by CMS. So we've still got a lot of really important work to do there, but that's a conversation. If you don't know, if you're working at a facility and you don't know what the plan would be if there is an emergency, that's something that you should bring up and start to ask questions about and make sure that folks understand kind of what the plan is and also how that plan would be executed. It should be something we talk about maybe a little more frequently than we are. All right, so we've hopefully done everything we can to prepare. We're ready to go. The disaster is going to happen. And so now we're doing kind of immediate response. We're in crisis during the event. So what are some of the needs that happen for older adults? quite a bit. There can be, addressing immediate needs post-disaster and responding to those. Sometimes that could be with folks that are trapped in a home or needing still to do some emergency evacuation, or maybe having some significant needs with medications. We also have a need for those that have been evacuated or relocated, what has been the impact of displacement and relocation? Do they have their immediate needs met in those settings? Oftentimes we need to establish shelters. Some folks will go to hotels or stay with family during events, but not everyone has that option. Sometimes there can be limitations due to financial resources or due to ability to travel. Sometimes folks need to take advantage of shelters that may be set up like by the American Red Cross or FEMA. And so those might be in schools or YMCAs or other kind of public settings where they've set up like cots and kind of an initial kind of hub of maybe some food and immediate resources. For most folks in local communities, folks don't realize that if you haven't been through the experience of working through a natural disaster, you become a responder by default. So, FEMA comes in, they help with things, they help with recovery. But in the moment of the crisis, yes, you're going to have, your local emergency response, your police, your fire department, et cetera, et cetera. But you are become a frontline worker if you are working in a setting where you are serving older adults. You are going to be the folks that are checking in on everyone, making sure that they're okay, that they're accounted for. Of course, emergency response is going to do some of that too, but there is, it takes time to get around the community and get to everyone. I'll give an example, with this recent Hurricane Helene flooding we had in Asheville. Folks that lived out in their own residences in the community, it was more than 2 weeks before emergency response got around to them. And I say that because there were so many other kind of crises that were happening that they couldn't get around to everyone until then. And so it was really neighbors. It was if there was like a service coordinator that worked in that apartment building, were the ones that were kind of frontline workers checking in on their folks. Senior centers, during a heat wave, they're the ones that are calling to make sure that folks aren't getting overheated. They're responders by default. And so it's important for folks to be aware of that and that there is help, but help may not get there quickly enough. And so you may have to step into a role to really kind of help folks more urgently. With residential settings, there's a lot of decision making. Evacuating certain residents can be really dangerous. And so you kind of have this, we don't want to evacuate folks if we don't have to, but if it's going to look like we have to, we may have to do it quickly. And so there's a lot of really tough decisions made about, how residents should be handled, what's going to be best for them, and what's going to do them maybe the least amount of harm in these type of situations. This is a really famous photo from Hurricane Harvey of an assisted living that flooded, that circulated around social media when that event was taking place. So as you can see here, the residents, their facility did flood, and essentially they, did not have a plan to evacuate. They didn't have the means to evacuate during the event. They weren't expecting to need to evacuate. And so they were kind of stuck waiting for responders to eventually get to them. And so you can see this is pretty distressing to look at. As I've mentioned already, and I just want to reiterate one more time, age itself does not create vulnerability for folks. It is those age-related changes that really compromise somebody for being kind of higher risk or increased risk for fatality. It's those things that accompany getting older. So things like having, more difficulty with your hearing, having some more issues with memory. Those are what's going to really kind of make someone an increased risk. It's not just the fact that they're in their 80s or in their 90s of and of itself. Age itself is not what creates vulnerability. Other kinds of things to be thinking about post-disaster, especially when you're thinking about maybe your patients or your clients. Do they have access to their medications? How essential is it to have some of those medications? Do they have access to medical care? what are some different ways that we can communicate with folks? I know I've brought up Asheville like a couple of times. I think that's going to be the next major event that we really talk a lot about, because communication really failed. Cell phone towers were down, electricity was out, and folks didn't have Wi-Fi. So it was really difficult to check in on folks. Folks were having to go by foot to walk to check on other residents. There really was no other way to get in touch with individuals. And so, how might you reach your residents if folks have evacuated and you can't call their home? Do you have their cell phone numbers? Do you have other family that you can potentially give permission to get in touch with on their behalf? What has been the damage to their housing, their facility, or other community resources? Have there been maybe some traumatic events associated with it? Did they see a neighbor get washed away in flooding? Did they have a pet die? Did they have a family member die? What are those behavioral health needs that somebody might have? And then what's been the financial impact? That's going to be really significant, especially as we start to look towards the recovery, the reconstruction phases. It is probably not surprising to hear that many folks have a multitude of reactions to a disaster. And I just want to remind folks that all of these are incredibly normal reactions. We would expect to see these. We would expect for much of them to be kind of short lived. But sometimes, some of these can linger. And so that's part of why things like psychological first aid are so important. So we can really start to tease out who has kind of more significant risk for maybe going on and developing something like post-traumatic stress disorder, those sorts of things. But it's completely normal for folks to feel hopelessness or despair, to feel a lot of shame. There's a lot of guilt, survivor guilt that comes in these disaster events. Folks can be in denial. Very common for folks to want to tell you their story over and over again about what happened, especially if it was a really significant event. They might be having flashbacks associated with it. And folks experience a lot of grief with these situations. And so we just need to be prepared to recognize that and know that that is a very normal part of this process of experiencing a crisis like this. Um, you know, there can be damage to residential facilities. And so when institutions are going to be closed for an extended period of time, that might force residents either to change facilities or reside in shelters or care outside of their community. This can have really significant impact for families. So just to be aware that that is potentially an outcome and something to be mindful of in terms of how that can impact that family dynamic. And then there can also be, with emergency relocation, folks with cognitive impairment can really struggle with kind of being thrown into a new environment. It's one of the biggest reasons that caregivers of persons with dementia, when they're living in communities, are really hesitant to evacuate, is because they're told so often, like, you should really try to keep the environment consistent. And so unless there's maybe a mandatory evacuation order, a lot of times folks will not leave their homes with somebody with dementia or cognitive impairment. So it's just important to be mindful of that moving folks like that into a different environmental setting can really cause a lot of behavioral symptoms to emerge, a lot of stress for caregivers, as well as, more professional residential caregivers. And again, just something to be mindful of. Medication, medical care access, I don't think I need to belabor this point too much, but we recognize that a lot of times folks won't have all their medical equipment, won't have all their medications when they're forced to evacuate or evacuate suddenly. And so there needs to be a plan in place in the community very quickly about how you're going to make sure that folks have those things that they absolutely have to have. Behavioral health needs are absolutely something that you're going to see as a result of any kind of traumatic event, any type of crisis, whether it's natural disaster or man-made. Relocation or hospitalizations can really impact folks, but also being disrupted in terms of having to change environmental settings if somebody has to go stay with family or move into a shelter. Do be conscious of how the media might be impacting older adults that are watching about the disaster on the news, especially for persons with cognitive impairment. They can get very disoriented and confused, and that can be a trigger for some additional behavioral symptoms. So I just encourage you to be mindful of that if you've got kind of the news on in the community room or something. That can really trigger folks with cognitive impairment to think that they're either still in a crisis or in some kind of threat they're experiencing, and so it's just important to be mindful of. With behavioral health needs, there's really a need to kind of screen out folks who, you know, have various behavioral health needs, and so I'm going to talk just briefly about kind of that process of psychological first aid and why we do that and why that's just important, just so folks are aware. But with the need for psychological first aid, this is really kind of a screening measure to really kind of rule out who are those folks that are they've experienced the trauma, but they're well functioning. They may not need kind of immediate assistance. That's going to be the majority of folks. That's going to be your first group. Your second group is going to be maybe folks who are more acutely distressed, exhibiting some rejection in their functionality, but with proper support, they can really get back to functioning kind of where they were pre-crisis pretty quickly. And then kind of that third screening with behavioral health, that third group we're really looking for, who are those folks who this event is going to have such significant impact on them that it may cause them to become dysfunctional and really impact their ability to execute, their day-to-day living going forward. And so that's really what we're kind of trying to do with behavioral uh, health assessments, psychological first aid, when we're talking with folks with disaster. And so, as a social worker, I go out into a lot of these settings with natural disasters, and I'm, administering psychological first aid. I'm really just trying to kind of remind folks about some of the different coping things that they can utilize to be able to kind of get through this crisis, this immediate kind of traumatic response, maybe even a little bit of an adjustment disorder, so that they can get back to their day to day. They can recover from the disaster and go back to kind of what they were doing before all of this took place. And so, as part of that psychological first aid, I'm starting to kind of identify the level of risk. Who are these folks that are kind of falling into some of these different groups? So, what about those folks that kind of have a little bit of temporary dysfunction? They might be a little more acutely distressed than others. For somebody like that, we're going to want to try to link them in with some crisis counseling, and hopefully that's something that could be available there locally in the community fairly quickly. Or if not, organizations like FEMA have been starting to even offer it remotely through telehealth. I've seen that offered now quite a bit over the last decade to respond to some of these major events. And so with crisis counseling, we're also wanting to make sure that folks aren't using some maladaptive coping mechanisms like substance use. We want to make sure that they're not experiencing depression, anxiety. And so that crisis counseling is really going to help them to address their challenges with coping and kind of recovering from the disaster. So again, they can get back to where they were pre-disaster. So that last group, which is a relatively small group, this is thought to be somewhere between maybe 6 to 20% of the population, depending on the event. These are the folks that, we're really concerned about. They've experienced some really significant stress as a result of the event, or maybe they've had kind of some cumulative trauma over the course of their lifetime, and they've really struggled to even cope with that. And now they've had this major event on top of that. These are these folks that we're really worried about that might go on to develop PTSD or acute stress disorder or more kind of severe depression. For them, formal treatment is really going to be much more appropriate. So this is your cognitive process therapy, prolonged exposure therapy, some ACT or acceptance and commitment therapy is going to be a lot more of a useful tool and a needed tool for those folks. And so part of that, going back to that first step of identifying who's kind of at level of risk, who are we concerned about, we're going to kind of start to identify those folks that we think may need more significant formal treatment as a result. Older adults and really anyone that's experienced a disaster really need a compassionate presence so that they can really be supported in talking about their crisis, the traumatic event that's taken place, and allowing us to really kind of have some opportunities for discussion. A lot of folks just really want to be able to tell you what happened to them. And so they just really need someone to do some active listening and listen to them. So be prepared to hear a lot of that. And if you are being exposed to a lot of that, being able to recognize kind of the secondary traumatic stress that can come from that. So being able to practice some self-care and taking care of yourself in that. But generally, folks really want to talk about that compassionate presence. Best thing we can do for folks after an event is really to get them back into the routine that they're used to. That's especially true for kids, but it's good for everyone. Um, Kids especially need to know kind of what's coming next. So they've had this major disruption, and now it's right, like they don't have other things to compare it to. They don't have other things to kind of cope with it. Um, Whereas an older adult has probably been through some other kinds of crises over the course of their lifetime. Many older adults are better suited to kind of deal with some of these type of events because of previous life experience. They have the coping skills. They've been through some of this versus folks who are kind of on the opposite end of the spectrum. Kids really need that routine. They got to know when they wake up, they're going to get dressed, they're going to have breakfast, they're going to, go to school or go to whatever. They need that routine. And I do think that's beneficial for older adults as well. So after the event, the recovery, the reconstruction stage, we're assessing and treating behavioral health needs, addressing the financial impact, talking about the impact that this has all had on the community. So some community assessments. A lot of times folks are talking about what could we do differently if this happened again. There's always loss across the community, whether it's, loss of individuals, loss of property. And so it's important to recognize the grief that accompanies this and the kind of the recovery reconstruction phase. There's a lot of physical rebuilding that takes place in communities. And there's a real need to kind of establish and expand community resilience. How can we be better suited if this happens again? With financial needs, the big thing I just want to highlight with older adults is that because many of these folks are often retired or they are, getting close to an age for retirement or will just continue working regardless of whether or not they're able to retire. And so they have some financial constraints. They have a limited time horizon to recoup their financial losses, which may make them more prone to financial devastation following a major event. And so it's important to be mindful of that. And we also know that financial stress can really impact the mental well-being of an individual. And so to also recognize how that financial impact might be playing a role in behavioral health needs of the older adult population. We learned a lot. Every event that takes place, there's folks that are documenting it, collecting information, doing research around these things. So we learn a lot with every kind of major event that happens. And so it's really cool when you see like a local community that's kind of been through a big event, put out kind of a report of what they've learned. Just because I think that all helps to inform us in terms of how do we do preparedness differently? How do we do response and recovery differently? That's all really good information. We know, again, going back to Katrina, we learned a lot from Katrina and that many folks that had to evacuate really needed medical care, more than half of the population. And so thinking about what that then looks like, how that shifts your demands, your needs in your community around that, and how do we do special planning to accommodate the needs of older adults that may have very specific needs that are different from the rest of the population. And so I encourage folks to continue to think about that, continue to plan for that. One thing we know is that natural disasters especially are not going away. And so we just need to be mindful of how we can best prepare and support folks. Two additional resources I just want to make folks aware of. The American Red Cross and the American Academy of Nursing put out a report about how to close the gaps for disaster preparedness, response, and recovery for older adults. This is one of the best resources, a best kind of summary of, evidence out there about how to support this population is in that report. So I'd really encourage folks to check that out. And then FEMA has also created a number of resources to help with disaster preparedness for older adults. If you're interested in disaster recovery work, I encourage folks to start by volunteering with American Red Cross and FEMA. Once you've done some recovery work with them, it kind of opens opportunities to be able to do other types of work. I now have been able to do serve on kind of national recovery efforts because I've been a long time Red Cross volunteer. I've been a FEMA volunteer as well, and so that's a great way to kind of get into this if you're a student and you're thinking that's something that's interesting to you, or a way to learn more as a professional. And then finally, I've just included a few of our papers and op-eds around this topic from some of the things I've learned doing this work. So I invite anyone, if you have any questions or comments about this presentation, you are welcome to email me. I'm at allison.gibson@slu.edu. That email again is just up here. So thank you so much for your time.